Was there a sense kind of going into getting the benzodiazepine that, hey, this is a substance that can be a little addictive or sticky. We're going to put you on it for a while with the goal you're going to get great sleep. Then we're going to taper you off of it.
Nothing. Nothing whatsoever.
Part of where there's so much confusion about these medicines is like, sometimes they can be really effective tools. I'm a psychiatrist, and so benzodiazepines are one of those tools that when people are agitated, they can't sleep. You're in this conflict now because there's so much misuse of them, that how they can be effectively deployed and how some of them are better than others, and how patients really need to be guided onto how to initiate psychotropic or mental health affecting medications in a skilled way, and how we start those and trial them, and if they don't work, we stop them. It feels like that's so often missing in something like this, where what strikes me about your story is the feeling of you really being alone in the midst of all this.
Yes.
And I'm wondering if there's a moment where you felt that the healthcare community or the COVID care community that you connected with finally kind of got together in a way where you felt less alone with this.
Well, cut to, I'm actually still on the Xanax because even though I had weaned myself off of it, by May 27th, the pericarditis had not resolved with any of the NSAIDs, and I was dropping weight rapidly, and I still wasn't sleeping, and I didn't want to go back to taking the benzos. So I crawled into his office when they finally opened, and he said, "We're going to put you on a steroid." And I was really hesitant to take it. I was really hesitant. My body was screaming no.
For everyone watching it, the thought is that you're having an inflammatory reaction to COVID-19. That has the pericarditis. You've got inflammation around your heart. It's chronic. It's not going away. They've tried an anti-inflammatory. Now you're going to get a steroid burst. Was the insomnia also getting explained in terms of part of a sequela of COVID? Was that getting explained as you worry too much, or are you too anxious, or was that just not being addressed?
From what I remember, the insomnia was because I was in so much pain. So there were nights that I just never slept because I was afraid I was going to die. It was very traumatic, highly traumatic to not sleep, to be in that amount of pain for so long. And then when they opened up his office, he prescribed that steroid. I was put on a pediatric dose, and within 4 days, they still call them internal tremors, but it was as if I was being electrocuted from my feet all the way up to the top of my head. So yes, the heart pain was less, but these internal tremors were unbelievable. So I didn't sleep again for 14 days straight. And I was terrified and suicidal. And I think one night I finally was like, I have to somehow get some sleep. So I took 0.5 of that Xanax, and it stopped the internal tremors. And I was able to get a couple hours of sleep. And you're going to roll your eyes at this. One neurologist said, well, to stop the internal tremors all day, she said, why don't we just put you on a slow release Xanax for the whole day? They have me up to 3 milligrams of Xanax. And I was absolutely out of my mind at that point. I was completely suicidal.
It feels like you're in a challenging place where allopathic medicine has given you some medicines that maybe have saved your life from the consequences of COVID, and at the same time haven't really fully served your needs. And it feels to me we're in a moment in time right now where there's a lot of conflict about allopathic medicine. Of when we need it, we're really grateful for all of this technology and all of these medicines, but it doesn't feel like individuals are as satisfied or it is getting the results as they'd like. And I was wondering if you could just share some of your thoughts on that.
I'm not grateful that I got the Xanax for the first time around for sleep. I would have preferred something a little less, aggressive. However, when the internal tremors showed up, that was the only thing that stopped him. And so it's very interesting how in the beginning I was like, I remember saying, this is a devil drug. And then when I really needed it, I was grateful to have it.
sort of hard in my profession because, first of all, I really appreciate that and your open mindedness that I find oftentimes people have different experiences at different times in their lives, or medicine serve different purposes, but they're not often seen as tools. It's part of where there's so much stigma about mental health. But I really, I think it is challenging also when there is something that helps you, but it has side effects. And for us as physicians, so often we're thinking about the risks and the benefits, and we're really trying to balance those. But for just speaking to a patient today who's having a great mood benefit, but having some sexual performance problems, it's a really challenging spot to be when you're struggling with your mental health. And so it is. It is a difficult thing to sort through. That, as I noted earlier, I think people often are left alone in, as opposed to being within a process to maybe process some of this.